Okay, thank you, Val. Now, this presentation looks at some research that we did in 2016. We did a cross-country survey of psychosocial conditions in Canada in French and English, and we had 4,000 participants. Peter Smith from the IWH was a great help to us in doing this and helped in the analysis. We redid the survey in 2019, and there were just over 600 who completed both the 2016 and 2019 surveys. And this slide is for those statisticians who want to know the details about the sampling, but I'll skip this. We asked a question about how you would rate the psychosocial health and safety climate in your workplace, and 55% would characterize it as good or healthy, supportive, whereas about 19% not so good, poor, or toxic. When asked whether the organization has a culture that tolerates behaviors that are harmful to mental health, 35% agreed or strongly agreed that their organization had a culture that did tolerate such behaviors. When asked whether they had a violence and harassment policy, which is probably mandatory in most provinces, 85% said yes, 10% were not sure. And when asked for those who had policies whether the policy was effective, 15% disagreed or strongly disagreed. And when you break that down by their experience of offensive behaviors, the more offensive behaviors they experience, the lower their rating of the effectiveness of the violence and harassment policy. We also broke these down by English and French responses and also by gender. And you can see on the violence and harassment policy, female respondents, both regardless of language, rated it worse than their male counterparts, and the same with psychological health and safety climate. And culture was close, much closer amongst the languages and genders. When it came to sexual harassment, the overall weighted average was 12.9%. The actual unweighted average was 11.5%. And clients, customers, and patients accounted for 5%, as did colleagues. Manager and supervisor and subordinates was around 2 to 3%. Threats of violence were 17%, and clearly the clients, customers, and patients were the major source of that. Similar to physical violence, which was 12%. When divided by, again, language and gender, you see that there is the most undesired sexual attention reported by English females. Males of either language were about the same, and French slightly lower than the English females. Threats of violence, again, English females much higher than their French counterparts. And for physical violence, again, English females slightly higher than the other categories. In Sweden, in comparison, sexual harassment using the same questions we used is 6%, threats of violence about 10.5%, and physical violence 5%. So about half for sexual harassment and physical violence. When it comes to bullying, here's our definition of bullying. It was in the last year. It's about 29%, largely coming from colleagues and superiors, as opposed to clients, customers, or subordinates. Discrimination, a similar pattern, a little stronger from manager and superior. And vicarious offensive behaviors, witnessing but not being the victim, about 38%, and evenly spread through all sources. When we asked the type of vicarious offensive behaviors, bullying was the predominant one, followed by discrimination. And about half the respondents had at least one of the 6 offensive behaviors reported. When it comes to language and gender, again, we see that English females reported the highest level of bullying, 36%, whereas in French language, it was fairly similar, a 2 percentage point difference between the genders. Discrimination, again, English females, as with vicarious offensive behaviors. In Sweden, in contrast, bullying is about 10.5%, similar to what Karen mentioned. The Swedish survey did not ask the discrimination and vicarious offensive behavior questions. These are the stress questions: burnout, stress, sleep troubles, and here you can see that generally the female respondents had a higher experience of these symptoms. When it comes to somatic and cognitive, similar, and then we summed the 5 symptoms into a single one with the same pattern. But this is an important slide where we looked at the symptom experience, much like Karen's flourishing, and compared people who had no experience of any offensive behavior, and their symptom scores from 0 to 100 were averaging around 37 to 40. However, if they had, for instance, offensive behaviors coming from managers and superiors, you can see that their levels were much higher, more symptoms. And if you work across from physical violence, you see that if you experience no physical violence, your symptom score was 40. If you received it from colleagues, it was 67. From managers, about 70. From subordinates, 55. And from clients and customers, 49. And you can see how the different power structure affects the symptom reporting. This is according to age, and it sounds a bit opposite to what Karen reported. For our sample, the younger people had higher rates of offensive behaviors and higher rates of symptoms. The only exception was sleep troubles. And people over 65 years old, there's a lot of selection in this group, obviously. They want to work and they don't have to, are experiencing the least symptoms and offensive behaviors. But especially when you look at undesired sexual attention, you see a very strong gradient from 31% down to 4% by age. And with also some of the other ones, bullying, are more stable across the ages. And we looked at size of workplace. And again, we had the larger the workplace, the more frequent the offensive behaviors, except for the very small workplaces. Our limit was 5 or more people, and there were a lot of workplaces with just 5, so we kept that as a separate category. And we compared the 2016 to the 2019, and undesired sexual attention went up just 1 percentage point, which represents 9% of what it used to be. Physical violence increased 17%, which is roughly 2 percentage points. Bullying went down, and so did the vicarious offensive behaviors. Now, of all these offensive behaviors, physical violence is probably the most objective. And somebody who looked at these results suggested that perhaps the toleration of some of these offensive behaviors is increasing. And that may be the reason. Breakdown by sectors. This survey was not designed to break it down by sectors, and some of the sectors are very not underrepresented, but very small numbers. But you can see here that healthcare and social assistance have very high rates of offensive behaviors. Also wholesale and food and accommodation and undesired sexual attention, discrimination, again, in wholesale trade. This category, administrative, which is call centers, the highest level of bullying. And as a comparison, in Sweden, the levels of undesired sexual attention were 6%, 10.5% for violence, 5%, and 10.5% for violence or bullying. And so I think I squeaked it under the. Thank you.
Wow, that's amazing that you managed to fit that in there. As I said, obviously a pro. Does anybody have any questions for John? It's a lot of information, everybody's information, actually. Thanks, John. I should have said thanks first. And for giving that picture. I think, I guess I have a question for each of you potentially with respect to how does the information that you've shared this afternoon, like, I guess, what do you think are the key things we should do with respect to prevention, or how can we prevent the harm and injury associated with bullying and harassment based on your research and experience? Catherine, do you have any comments on that?
Yes, can you hear me?
Yes.
Yeah. Okay. Well, I think the important thing is if you want to prevent bullying and harassment, you have to address the psychosocial hazards that determine bullying and harassment. So the high demands, low control. Bullying doesn't come out of nowhere. It's rooted in psychosocial hazards and in bad distribution of roles so that people don't know what they're supposed to be doing, management by competition. And the best way, from my understanding, to prevent that is to have joint union management or joint worker management discussions about the risk assessments that are in the specific workplaces. And if you're in a context of restructuring in Australia, Michael Quinlan's written a piece where it's in the law in Australia that if the business or the undertaking is going to be restructured, there have to be risk assessments as to the psychosocial hazards that will be generated by that. If you want to prevent bullying, I think that would be a good start.
Great, thanks. That's a good idea. Karen, what are your thoughts?
I think clearly it's am I on there?
Yes, you are.
Okay, great, thank you. It's not an individual responsibility. It's really a systemic issue, and it needs to be approached as an organizational problem to prevent. And the Australians are doing some really exciting work looking at the lever of psychosocial safety climate. That's something that we in our research want to now test here and look at the validity of building that from the organization top down to prevent. And again, simply policies in and of themselves, having a policy is not enough. The policy needs to be understood. People need to be aware of it. People really need to know what it means and how to act in order to comply with policy. And so ongoing enforcement monitoring, ensuring that it's a living policy and it's a meaningful policy, it's a meaningful commitment to reduce bullying, mistreatment, has to be reinforced, I think, at every opportunity.
Thanks. Thanks. John?
One thing that struck me when doing the survey was the difference between the French results and the English results. And it talked to, and that was reinforced when we compared it to European results. For instance, Sweden, is that there's a culture difference. If your culture tolerates offensive behaviors, and as Catherine mentioned, even encourages it through encouraging competition between workers instead of cooperative working together, there is a serious price to be paid. And However, changing that culture as we get involved in individual workplaces and try to actually do that, which reminds me, I have a call in 20 minutes to do exactly that. Working it out in practice is very difficult because not only are there policies and procedures, and not only are there organizational and psychosocial factors, there are personalities and beliefs and opinions that need to be changed, and that process takes a lot of work. In our experience, it works best in workplaces that are very progressive and willing to change, but also it works well in workplaces that are toxic, where something has to change or the organization will suffer immensely. So when it becomes a crisis, then in the workplaces where it's not an urgency, it doesn't seem to have as much traction as those which really want to or really have to.
Okay. Thanks, John. Yeah, I think all those points are really valid. We don't have any other questions, although someone is mentioning that, of course, enforcement of the policies instead of just posting things up, which I think goes exactly to your point about tolerance of offensive behaviors, John. I also was wondering, and I don't know if who of you could, I guess the workplace has changed. I guess, what do you think this dynamic of our current having our meeting, all of us in our own homes, I guess the current dimension of so much sort of individual isolation professionally and personally, and is it making people, I think people are more tolerant of the sort of technology that we're all having some frustrations with, but I guess, do you think any thoughts around that? We are going to talk about it actually in 2 weeks in terms of what the survey shows, but anybody have any thoughts on that?
Well, if I can give you a sneak preview of what we found. What we found, and Peter Smith was the one who did this analysis, is that those workers who are going into workplaces and are comfortable with the level of protection and policies in place are having less stress than those who are working from home, which was kind of surprising to us. We thought, if you're working at home, you're safely away from any exposure. However, the workers who were in their regular routine and who trusted the safeguards that were being applied in the workplace were experiencing less stress than because they were in their normal swing of things than those who are working in isolation from home.
John, can I ask a question of John? John, of those people who were working from home, did you pay attention to differences between people who had young kids at home and people who did not? That was my question. And what I would have thrown in was techno-stress is something that I think is really important to track. And I don't know, I'm hoping that you're tracking that in your survey.
Unfortunately, we did not. And I can relate to the techno-stress because this morning we had power failures and internet failures. So I was worried about being able to present. And it's not just young children, it's also grandchildren. Well, I guess they're young children too. There are a lot of variables. However, we started our survey with healthcare, frontline healthcare workers, and then we adapted it to other workers. And we were largely thinking of those who were still going to a workplace. And so those who were working from home kind of fell through to the cracks, unfortunately. But that's what happens when you do these things on the fly in a crisis situation.
I did actually include the links to the two surveys because, of course, you're still collecting data and still invite people to share them to be completed. And they're meant to be that people have the opportunity to go and submit if things change or if things don't change. If they just want to tune in every month and let us know how things are affecting them, the pandemic, working during the pandemic in whatever way, shape, or form that is. Invite participation.
Yes, the idea was that each participant would create their own personal ID. So if they used it again, then we could connect their previous results with their current ones, and they could, as things change, they could fill out the survey once, twice, or 3 times, or however many they would like, and then we could perhaps track the change.
Good. And so that will be we will be talking about the survey results on May 29th. So next week's event is focused sort of internationally, although we may tie in a little bit at the end about how StressAssess and the CopSoc itself, the tool that is the core of StressAssess, how it relates internationally. So we have Tony Scott displayed next week. We hope many of you can join us with Peter Kelly from the UK sharing their experience. Norma McCormick, who's been involved in the CSA standard as well as now working as one of the co-conveners of the ISO standard, 45,003, and then 2 speakers whose names we do know, actually, Paul Landsberg and Marnie Dawson-Zimmerman, who will be joining us from the Healthy Work campaign in the US. We're looking forward to that. And then the week following will be the worker experience survey. It'll be some tips on getting the most out of running a survey in your organization, with tips with Terry Szymanski and then Daryl Stevenson from OCOW, talking about the comments and the value in collecting and analyzing comments, not just individual answers to the questions. And then our colleagues from WSPS will share a module they've just developed on protecting mental health when working from home. So that's coming up in the next 2 weeks. And there's a few comments which I assume everyone can see. The one around the relationship between workplace harassment and suicide, so basically applauding that it was, I guess, mentioned here today, but I guess it's not applauding that it happens. I don't know if any of the speakers have anything to add in that with respect to suicide and its potential connection to.
Yes, I will just add something, and Jenny, I agree with you completely. I think we're not talking about this. We don't know enough about this. This is not the level of public knowledge that it should be. And I even say that in the research literature, we don't have studies that yet longitudinally establish the direct link between bullying exposure and suicidal behavior. And so that some researchers deny that there's a link on that basis, rather than suggest that, well, of course we know this from all kinds of public events and public cases around the world. Let's gather the data and look at it more carefully empirically. So we definitely need to raise awareness about those connections.
Sorry, I think Tony and I are turning my microphone on and off because I was pouring my tea earlier, and I apologize for that. Thanks, Karen. Catherine, you talked about a couple of actual cases that have been compensated. I guess, are there many others that haven't you're aware of? Or?
Are you asking in relation to suicide, or are you
yes.
are asking?
Yes.
Okay. So in relation, I only have information. Well, there's 2 things. I think, and Karen already talked about France Télécom and what happened in France, but I think it's important to underline that the CEOs of France Télécom, which is the equivalent of Bell Canada, were criminally convicted for the harassment, management by harassment that led to all these suicides. I suspect that's now in appeal, but there is a criminal conviction of the top management. And I think that's important. France is, of course, way ahead of anything happening in Canada on using criminal law in the workplace. In terms of suicides, the cases that I know about that have been compensated are in Quebec. And there are a few, they're not that many. And they're very hard to win, but they're very difficult cases in any case. Most workers' compensation claims that are accepted for suicide are related to chronic pain and people who have serious physical injuries and then develop mental health problems associated with chronic pain, and that leads to suicide. And there's several of those that have been compensated. But in terms of harassment and bullying, there's the two cases that Karen mentioned that the boards have accepted. But in terms of the case law, I don't know of any case law, except the cases I know in Quebec that were compensated for stress-related things. It wasn't harassment and bullying, and it was a case involving a worker whose job had been, my English is not as good as it used to be. Basically, he'd been laid off and then was asked, it was a subcontractor for Canada Post, and he was one of these delivery people who were working in the country, and they decided that instead of outsourcing to SNC-Lavalin, who was his employer, they were going to take that back internally, and they asked him to train his replacement, and he committed suicide shortly after that, and that was compensated as being work-related suicide.
Okay. And PTSD, I guess, is that some of the reason for I guess PTSD is recognized as a disability, and the presumption that has followed that was any element of the PTSD presumption legislation related to suicide as well? Suicide prevention, I guess.
Well, suicide prevention, you don't need the compensation legislation for that. Normally, all health and safety legislation should be predicated on preventing suicide. One of the reasons why they've been adopting these presumptions is that, and this comes out in that report that I discussed, sometimes it takes like 3, 4, 5, 6, 7 years before you get a final decision that says, yes, your PTSD is work-related. And there are egregious cases, firefighters who are told many, many years later. So of course, the longer people have to battle to get recognition of their disability, the less likely it is that they're going to come out of this unscathed, and suicide can be part of that problem. That can lead to suicide. I haven't seen compensated suicide cases, though.
No, I'm not aware of that many either, but I haven't been studying it like that. It is.
I would hope that the boards are accepting these claims, and that's why we don't see the cases. But I look forward to hearing evidence of that.
Well, we can set that up for next year's May Day, maybe a bit more information from across Canada on cases that have been compensated, maybe in their incidents, and whether there's a correlation. We won't have any new, we won't be doing the StressAssess survey again probably until 2022 if we stick with the over 3-year pattern, but it would be interesting to see if there are any provincial correlations to the legislation, recognition of the hazard and prevention, and compensation as one piece of prevention. Okay, I don't see any more questions. So I think we can probably wind down now. We will, as I said earlier, we will share the slide decks along with the videos, probably because it's a short link. They'll be up probably by Wednesday at the latest, I would say. And I will probably send everyone a reminder of the 2 subsequent sessions, and also then links to those to the page with those documents, although I did have it in the beginning of the chat here. And also, we do invite people to give us feedback on the sessions. It is important to us. We have transfer payment agreements that we have to show that we had some reach, and we also potentially had impact, and also to be able to improve continuous quality improvement, hopefully in future events like this and on other subjects. Also very interested in subjects that might interest you. So thanks again for spending your Friday afternoon with us, and thanks to the 3 speakers for their preparation and presentation. And I hope everybody has a healthy and safe long weekend, and that it feels like a long weekend, a bit of a break, and of course into the future. And we'll see hopefully many of you next week. Thanks. John, you have to go, I guess.
Yeah, I got another call at 3:30, and they haven't sent me the Zoom link yet. So.
Oh yeah, I know how much anxiety that causes people.
Yeah.
We had some
Yeah.
kind of
Techno stress, that's really it. I said thanks, and I think my thing was off, so thank you very much for organizing this.
Oh, well, you're welcome. We sure didn't want the month to go by, May to go by, without having continuing this dialogue, even though of course it is an issue every month of the year, but we've started focusing on it every May, and we certainly want to keep doing so. Yeah, we really appreciate everybody's involvement and participation. We had, I think, 81 people, or 82 were the highest number I saw today, and for much of the time, which is good. We are down to 14 participants. I think if anyone's on and who wants to add a question or say anything, you are welcome to click on your own microphone.
Okay, I'll take this opportunity to leave then. Thank
Okay.
you. It was nice presenting with Karen and with Catherine. And take care. Have a good weekend. Bye.
Yep.
Take care,
Bye,
John. Yes, take care.
And the technology held out for everybody, which is good, even though we had our backup plans. I had the PowerPoints ready on my screen to share if need be, so that's good. It's just like an umbrella, right? If you actually take the time, then you won't need it.
Exactly. Anyway, it worked perfectly, so thanks to the tech people as well.
Tony, yes, we do appreciate your ongoing support of these initiatives. Okay, I think we can say goodbye to everybody. And Karen and Catherine, once again, yeah, thanks very much for taking the time to prepare and to spend the afternoon with us, and hopefully we can work together on other things related to this.
I look forward to seeing your next results.
Yeah, thanks.
Okay, take care. Bye-bye.
Bye-bye. Yeah, your turn. Great.